pus from our teeth or pus in our gums, it's something which you don't want to talk about, but it's one of the commonest problem that is there. So in this particular video, let's look at what are the different reasons which can cause a purulent discharge or a pus discharge from our gums. What can be the reasons and what needs to be addressed, how do we address it also, we'll see in this video. Before we go into the video, what we need to understand is when there is pus formation in our gums, it means that we are already at an advanced stage of a tooth disease or a gum disease. We have already ignored the different stages of tooth disease for a very long time, resulting in a very advanced level of disease. So we should have taken action before. We have not taken action at the appropriate stage. So it's time, when there is pus, it's always important to go meet the doctor immediately to ensure that the infection from the pus doesn't spread to the other parts of the body. It's very, very important. So now let's look at the causes here in this video. Hello, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Rajanamalapuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to pus, let's address it. There can be two different reasons. One is from the tooth cause, another is from a gum cause. Usually, a tooth cause will usually be a localized one. What do I mean by localized one? It can be related to only one particular tooth. So usually what happens, there is a decay process in the tooth. The decay process from the outer layer of the enamel has gone to the inner layer of the pulp. Usually it starts at the tooth sensitivity, then there will be slight pain will be there when we eat our food. Food will go and get caught. So this is an early stage where it needs to be attended. We ignore this. From the pulp, it goes to the inner root surface. When we bite on the tooth, can be extremely painful. When we lie down on the bed, can be painful, and we can wake up in the night with tooth pain. So now this usually will make you seek attention, but for some reason you didn't seek attention, ignored it, took some over-the-counter medication, forget about it, and then what happens? So the tooth decay has spread from the outer layer of the tooth to the root, and then it spreads to the bone. And when it spreads to the bone, then what happens? There is bone loss that happens. So this is the bone that is below the roots of the tooth. So because of this bone loss, there is bacteria that affects that. Bacteria colonizes there and starts a purulent discharge, start a pus discharge. So from that part, so there is pus there. From there, the pus tries to break open and come out. It exposes the bone, it resorbs the bone, comes out and then comes out through the gum. So now in this stage, typically what will happen is you'll see a small pustule or like a small localized swelling that happens under the root of one of the tooth, and usually when you press, there is going to be a yellowish discharge, a pus discharge that comes out, and then the swelling will subside. Frequently it swells up, some liquid comes out, then it subsides. The liquid will have some a foul discharge, a salty taste. So it means that it's a pus that is forming there. So it means that there is a lot of bone loss that has happened, which we have missed seeing the doctor at an early stage. It's already in an advanced stage. It's very important to go meet the doctor immediately to ensure that this pus, the infection doesn't spread and affects the other parts of the bone. So this is one of the reasons. The next generalized reason can happen because of gum disease. So gum disease typically starts with calculus buildup, plaque and calculus buildup. If you have done scaling at an early stage, usually it doesn't progress further. But say we ignored it. So there's a lot of inflammation in the gums. This gum inflammation, and because of the bacteria, the food, the minerals from the saliva act on it, produces a lot of toxins. These toxins can cause not only inflammation of the gums, can also lead to bone loss. So the periodontium, that is the covering structure of the tooth, can get inflamed and affected. Now this can usually lead to a bone loss, and there can be something called the pocket formation. What do we mean by a pocket? We have a gum that is at a higher level and a bone at a lower level. Typically the bone is about 1.5 to 2 mm below the gum level, which is normal. Slightly more can happen in some instances. But here sometimes the bone can be found 8 mm below the gum level. So it causes a pocket. It's like an empty well there, where food goes in, bacteria goes in, a lot of toxins, causes a severe gum inflammation. This gum inflammation can lead to a pus discharge there. So it's usually not restricted to one tooth, it can be one or several teeth. Again, it's a sign of an advanced gum disease. Mostly, treatment will be to extract the tooth, but sometimes we might still be able to save the tooth based on the amount of the progression of the gum disease. So if we seek attention of a dentist at an early stage, we will be able to treat this process also and save our teeth. So these are the commonest causes. Very rarely, sometimes what can happen is, typically there can be a small space between the teeth, and then when we have our dinner, some food goes and gets caught. We don't use an interdental brush or we don't use a floss, but we either use a toothpick or something or the other that we are able to get our hands with. And then we end up, instead of taking the food debris out, we end up pushing it deeper into the gum. When you push it deeper into the gum, it can get lodged between the gum tissue and cause a localized inflammation there, can lead to pus discharge. The next, it's a simple process, it's a traumatic process that has happened. A localized cleaning and a curettage will help to clean that area, will help to prevent this. So these are some of the commonest reasons for a pus discharge from the gums. What I need to understand is, it's important that we know it's already at an advanced stage. We should seek an early treatment from the doctor to prevent further complication that can happen because of this. Hope we have answered this question. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.